we're going to be discussing assessing your patient's IV site for possible problems and how to spike and prime your IV bag and tubing, and then how to connect that to your patient. This IV pump may be different from the pumps that you're going to be using in clinical, but the premise is the same. You have a primary rate where you're going to enter the rate that's been ordered, and you're going to have a primary volume to be infused, which is the amount of fluid that's going to be in your bag. So let's go ahead and go to our patient's room. This patient has been admitted with some dehydration. He came into the emergency department and they started an IV in his arm, and he just got up to the floor, and you read in the chart that he's to have normal saline at 75 milliliters an hour. So let's go ahead into the patient's room and assess his IV site. The first thing you want to do is make sure that you've washed your hands. You walk into your patient's room and introduce yourself. Good morning, my name is Becky, I'm going to be your nurse today. Could I take a look at your armband? Let your patient show you their armband. Could you tell me your name and date of birth? He tells me, and it matches exactly what's on the armband. And do you have any allergies? No? Okay. An order has been written for you to have normal saline infusing at 75 milliliters an hour. You're suffering with a little bit of dehydration, and we're going to get some IV fluid started for you. But first, could I take a look at your IV site? Thank you. When you're assessing the IV site, you want to make sure that you are gently palpating above the level where the IV catheter is located. The catheter is about 1 inch long, give or take. It's just a small, flexible tube. There is no needle here. And you want to gently palpate around the area and ask your client if they're having any problems. You don't necessarily want to say, does this hurt? But ask if he has any problems. And if a small problem is developing, you're going to get a reaction of pain from the patient. The other things that I'm looking for as I'm touching are 3 possible problems, and those are infection, infiltration, and phlebitis. Infection would look and feel just like if you were to scrape your knee and it got infected. The area could be red, swollen, painful. You could have purulent drainage around the area, and there could be warmth. Infection isn't terribly common in peripheral lines because they're only in for generally 72 hours. Where you may see signs of infection is on your more permanent central lines, like a PICC line or an internal jugular. Another complication that you may see that you need to evaluate for is phlebitis. Now, phlebitis is actually inflammation of the vessel itself. This catheter is going into a blood vessel, and sometimes the fluid or just the pressure itself can cause a patient's vein to become red, hard, irritated, swollen, and very painful. Again, that's just going to be the vessel itself for phlebitis that's got these problems. You won't see generalized swelling with phlebitis. The next problem that you may see is infiltration. Infiltration is where the fluids that are supposed to be going into the vessel are actually going into the surrounding tissues, and it's causing swelling. It may be leaking. It could be pale. It could be cool to the touch. And if the fluids that are going in are highly irritating, potassium for example, the area could start to get a little pink or red as well. Again, this is very painful. In any of these cases, if you detect infection, infiltration, or phlebitis, you're going to need to take that IV out. That IV is no longer good, and the patient could suffer some serious harm if the line were to stay in. Now, there's one final step that we need to do to further assess whether or not this IV site is patent and working well. My patient didn't complain at all when I tapped around the area, and I didn't note any signs of those 3 problems. I won't really know if this is working well until I flush it with 3 milliliters of normal saline. Keep in mind, some hospitals now flush peripheral lines with 10 milliliters. So make sure that you check your agency's policies. The first thing that you want to do is clean this port. This port is for connecting IV tubing or syringes for medication administration. There's a lock on the tube, and this needs to stay locked anytime this line is not infusing. That prevents blood backflowing into the IV catheter, possibly causing a clot. So we need to keep this locked whenever it's not in use. I'm not wearing gloves because there's no blood in any of these areas. However, if your agency dictates that whenever you're handling an IV line that you wear gloves, be sure to do so. Also, if there was any blood around this area, obviously I would wear gloves. Clean the site with an alcohol prep. Notice that this port should always be taped to the patient's arm. That decreases the risk of the IV being yanked out. And scrub for 15 seconds. Now I'm going to take the cap off of my pre-filled saline flush. I have to keep this end sterile, so I'm careful not to set it down or touch it. I also have to make sure that this hasn't touched anything from the time I've cleaned it. If, however, this were to have hit his bedclothes or I touched it, I'd have to re-clean it. Now I'm going to press on and twist. This is a lure lock connection. Unlock my tubing, and I'm going to use 2 hands so I don't yank on it. So I've unlocked it by sliding it over. And now I'm going to gently start to infuse my 3 milliliters of normal saline. While I'm doing this, I'm looking to see if it's leaking, if any swelling is occurring, or if my patient is complaining of pain. He tells me that feels fine. Before I take this syringe off, I'm going to go ahead and lock this, pushing it forward using 2 hands so I don't dislodge the IV, and then disconnect. This will go in the sharps container. Now that I know my IV site is patent and free of problems, I'm going to go ahead to the clean utility and get my supplies. I've gone into the clean utility room and I've got my IV fluids. This is 0.9% sodium chloride. It's a 50 milliliter bag. Make sure you're getting a bag that's the right size for what's ordered. Typically, if I have a patient who's going to be getting continuous IV fluids, I would have grabbed a 1,000 ml bag or 1 liter. However, just for demonstration purposes, I'm just going to go ahead and use this 50 milliliter for you. Take it out of its wrapper here, and it's usually perforated at the top. Don't be worried that you're going to tear the IV bag, you won't. The other things that I want to look at on my bag are the expiration date and the color of the fluid. I want to make sure it's not an off color and that there's no sediment floating in the IV fluids. Next, I've grabbed my Continue Flow IV set. These bags as well are going to have some perforations, so look at the back and see, and it's easy to open if you pull right along that perforation. As soon as you take the IV tubing out, go ahead and tear this off. The first thing you always want to do to your IV tubing is clamp it. Now bear in mind that IV tubing at different hospitals is going to look different because it's going to have to fit into the IV pumps at that institution. So some of them will have cartridges that will also need to be locked. So just make sure that you're finding out how to lock that tubing completely. Otherwise, as soon as I spike this into my fluids, it's going to pour all over the floor and all over me. Now that I've prepared that, I'm going to go ahead and get my patient labels because I need to label my tubing and I need to label my IV fluids. At your institution, you may have specific IV labels. Make sure you use those for the IV tubing. Many institutions will use a patient label to put on the IV bag itself. So that's what I'm going to use for both. So for my tubing, I'm going to write on a label the date, the time in military time. Remember, there is no colon in military time, and my initials. And just below the drip chamber here, I'm going to affix that to itself. So I'll bend it over, affixing it to itself. It's important that I put the date and time on my tubing because it's only good for a certain number of hours. If it's continuously flowing or continuously infusing tubing, it's good for 72 hours. If it's intermittent, meaning I'm hooking it to the patient and then discontinuing it for a period of time, hooking it back up to the patient, that's called intermittent tubing, and that's only good for 24 hours because we've increased the likelihood that bacteria may start to grow in that tubing. For my IV bag, I'm going to go ahead and write the date, the time, again in military time, and my initials. I'm also going to write the ordered fluid and rate. So for this, I'll write NS for normal saline. I'll write the @ symbol, 75 milliliters per hour. remove this. And it's okay to put it on the front of the bag as long as I'm not covering the amount, the drug itself, or the expiration date. Be careful though, some places you have to scan this sidebar. Make sure you don't cover that if that's the case. Now, you have two choices as to how you can spike this bag. You can do it while it's sitting on the counter, as long as when you pick it up, you're holding the neck of the IV bag straight. That's important because if I were to bend it and put my sharp spike in, which is on the end here, I could go right through this bag and make a hole, and I'd have to throw the whole bag away. So it's okay to spike it right here on the counter. Make sure that you're holding this neck straight. I prefer to hang it up and spike it, so that's how I'm going to demonstrate it. I've hung my IV bag, and I want you to notice that there are two ports on any IV bag. This one over here has a rubber stopper. That's for injecting medication. This stopper is the one that you want to pull off. When you pull the stopper off, there's a small plastic piece here that prevents fluid from running out of this bag. However, after you have spiked this through that, and later when you go to take the bag down, if you pull this out, guess what's going to happen? Fluid is going to flow all over the place. So I'll show you in a minute how to take this down without making a mess. So the first thing that you want to do is pull the stopper out. I'm going to hold the bag and just pull. I want to keep that area in there sterile, so I'm going to be careful not to touch that area. Next, I'm going to remove the cap from my spike. Remember, you've got your tubing locked. That's very important. I'm going to remove the cap. This must stay sterile. If it hits the bag somewhere or hits my hand, I have to get a new one because I've contaminated it. So keeping this sterile, I'm going to go ahead and hold the neck. Remember, I don't want it to be bent. I'm going to hold the neck of the bag straight. I'm going to insert, you push, I go left, right, left, right, left, right. And I've perforated that little plastic piece. So now, watch what happens when I go to fill my drip chamber. And squeeze this drip chamber. There's a small line here. It's about 1/3 of the way up. I squeeze and let go, and fluid comes in. Perfect. Now, that was the spiking part of spike and prime. Now I'm going to prime my IV tubing, which means filling it with fluid and removing all the air. Now I've still got this clamped. I'm going to need to slowly unclamp that while I'm watching my drip chamber because I don't want this to pour through too quickly because then I'm going to get many, many tiny bubbles in this line. And I don't want to have bubbles in this line before I connect it to my patient. Notice too that there is another hook on here, a clamp. If you need to, you could have also locked that. On the end of this tubing is a sterile cap. I need to keep the end of this sterile because it's going to be connected to my patient's IV. So I don't need to take this off in order to prime the line. These are designed such that you can keep them on and keep the end sterile. I'm going to slowly unroll my roller clamp while I'm looking at my drip chamber, and you can see that it's starting to drip, not too quickly. I'm over a trash can or over a sink. I unroll a little bit more, still watching my drip chamber. And I'm following the bubbles all the way to the end of my tubing. And it's dripping. Now I'm going to go ahead and lock it so it stops dripping. Now I have filled my whole line with fluid and removed all the air. If there were any air bubbles, I would need to continue flushing that line to get those out. However, bear in mind that as you continue to prime that line, you're flushing that medication out. You want to be careful to prime the line correctly the first time. The next thing I want to do is put my tubing through my machine. Again, this is an older machine, but the premise is the same. You're going to have tubing that has a cartridge on it that's going to fit somewhere in your IV pump. For our purposes, I'm just going to open the door and set my tubing in here. So pretend with me that we've put the cartridge in the machine in the proper fashion. You need to turn the machine on. The next thing you need to do is hit the primary rate. And the rate that was ordered for our patient was 75 milliliters an hour. So I'll push the 75. Then I'm going to hit primary volume to be infused. My bag is 50 milliliters. However, I've flushed probably 10, 15 milliliters through this line to prime it. Therefore, I'm only going to set this pump for 35 milliliters. The reason that I want to do that is so that I have time to change my bag before it runs dry and fills my tubing with air. Then I need to go into my patient's room and I need to connect it to my patient. I've washed my hands. I've re-entered my patient's room. Assess this port one more time for patency before I connect my tubing. Clean the site with an alcohol prep, again scrubbing for 15 seconds. I need to keep that sterile. Remove the cap from my 3 milliliter normal saline syringe. Connect the two, pressing and twisting. And unclamp the clamp using 2 hands so I don't pull that IV. Gently flush that IV. Again, I'm looking for any problems. I'm making sure that it's not blocked, that I can flush that there's no leaking or swelling, and that my patient isn't complaining of pain. Take that off. This will go in the sharps container. I'm going to keep the end of this port sterile. If it were to touch his arm, I'd have to rewash it with alcohol. Now I'm going to take my IV tubing and take off the cap. I must keep this sterile. When you put this into the IV port, don't push it in. It makes it very difficult to take it out. What's going to secure it is this screw cap on top here. So gently set it in there, push the screw cap down, and twist, making sure you've got a good seal. Again, if your institution dictates that you wear gloves when handling IVs, make sure you do so. This is remaining unlocked so that the fluids can flow into my patient. And I'm going to go over to my IV pump and hit start. If you still have a roller clamp clamped, make sure you unclamp it at this time. And I'm looking at my drip chamber to make sure it's dripping. And I'm looking at my patient's arm to make sure that he's not complaining of any new burning or pain. Even though it flushed well, the IV fluid that I'm infusing may cause more discomfort than just the normal saline. Now, before I leave the room, I want to secure this IV tubing to my patient so that it doesn't get yanked. So a little bit higher here, I'll put one piece of tape just on this tubing to secure it. When it's time to either change IV bags or discontinue the IV altogether and you need to take this down, there's some important steps to take. The first is to pull it down off of the IV pole. And you can see there's still a little bit of fluid in here and in the drip chamber. If I just pull this right off this way, fluid from this bag is going to go everywhere. So what I want to do is turn this over. Of course, I've turned my pump off already, or I've hit pause. I'm going to squeeze the fluid that's left back into the bag while you pull this out. Then you're going to take what's left in this bag and dump it in the sink. You've got another bag hanging here. You're going to take off that port, spike, you're going to hit resume, and you're going to tell the machine primary volume to be infused and how much you just hung. Anytime you're caring for a patient who has an IV site, you want to enter the room when you first come on shift and perform a few key assessments. Hi, my name is Becky. I'm going to be your nurse today. Could I take a look at your armband? Can you tell me your name and date of birth? It matches exactly what's on this armband. Do you have any allergies? No? Okay. May I take a look at your IV site? Thank you. I'm going to perform my assessment. Do you have any problems with this site? No? Excellent. And I'm looking for those 3 problems at the beginning of every shift for every patient who's got an IV site. The other thing that I want to notice, I see that he's got an IV infusing. I got a report that he's got normal saline hanging at 75 milliliters an hour. So now that I'm in the room, I do a quick glance over at his IV fluids and I make sure that that is what's running. I also make sure that it's not expired, that it's not older than 24 hours. I make sure that my continue flow tubing is not expired. Remember, that's good for 72 hours. And that my piggyback medication has run in, and that tubing has not expired. It's only good for 24 hours. Then there's one other important thing that you need to discuss with your client. Mr. Donovan, If at any time this site becomes red, swollen, painful, or starts to leak, I need you to ring your call bell and let somebody know right away, okay? By educating your patient, you're making them their own best advocate, so that when no one's around, when a problem begins, they know to ring that call bell. You can discontinue that IV and save them potential tissue damage.